You know, we've been to Dr. Sonia Spencer Chiropractic so many different times, and we wanted to talk today about all the different types of conditions that they do treat here at Spencer Chiropractic on Pass Road in Gulfport. Dr. Spencer, how are you?
I'm doing wonderful, Jim. It's good to see you.
Well, it's good to see you too. Now, we've talked about different things. We've talked about tech neck. We talked about back, legs, feet, this and that, neuropathy and everything else. We wanted to really kind of go down and summarize all the different things that you do treat.
Yes, well, like you said, we do take care of neuropathy pain here, and that's missing from our board. But you know, a lot of people don't think about chiropractic when they think about headaches and migraines. But I'm going to tell you here, I've had lifelong sufferers of migraines get relief from chiropractic care, and you know, had a lot of patients be able to get off of medications that they take, and even tension headaches coming from stress of tight muscles, tight joints, putting pressure on nerves. So we get great results with headaches and migraines. Of course, neck pain and stiffness. Your neck is called your cervical spine, but you know, everybody's down on their devices doing their little deal, and this puts pain into the neck and shoulders. And of course, driving down the interstate. I was just driving
the traffic today, yes.
Yeah, it's something, and all the little blockages and wrecks that occur, and you know, tension on the road. A lot of causes for neck pain and stiffness, and we get great results with neck pain. It's one of my favorite things to treat. You know, problems in the neck can cause pain to go down into the arms and hands. And you know, just this morning I had a patient with failed neck surgery, failed carpal tunnel surgery, and looking for the cause of his pain and numbness down into the arms. There's several places that can get trapped, and we can release that and get great results. And you know, one of the number one reasons people come in here is leg pain.
Really?
Yeah. You know, that once that sciatic nerve, which is the largest nerve in your body, gets aggravated from either twisting in the hips, over tightening in the butt muscles, or problems with disc in their back, it's excruciating.
And if you're sitting behind a desk all day, I mean, for a while, and not getting any motion, won't that cause some problems in your hips and your back?
You know, sitting is the new smoking. And a lot of people
really?
say, yeah, that's what they say as far as health of the body, that it just, you know, can deteriorate you. And a lot of the patients that come in with disc herniations sit all day, you know, and don't get the movement. You know, that disc is like a shock absorber and a sponge. It needs movement to stay healthy. So anyway, you know, we love to treat shoulder pain and carpal tunnel. We get great results with that with patients who, you know, don't want to have surgery or have had a failed surgery. We have several different treatments, adjusting the wrist, our new piezo wave, and our class 4 laser, getting great results with that. So good old low back pain from, you know, up around, well, really anywhere.
Upper back or lower, yeah.
Neck to butt, you know. So anywhere you have back pain, we do chiropractic adjustments. We have therapies for people who can't get adjusted because of prior surgeries, or you know, are just afraid of adjustments, don't want to have adjustments. We have therapies that can help those people.
Well, I have to jump in here and say a few years back I was involved in a accident. I got broadsided somebody in my truck, and put myself into Dr. Spencer's hands, and tell you what, because I had some back and neck pains, and it was amazing. It really helped me out. It really helped me out. So.
Yeah, and chiropractic is the safest form of treatment there is. I mean, there's no other treatment that's safe, and that's based on our malpractice insurance premiums. They're less than some people's car insurance.
Really?
Yeah.
It's non-invasive.
It's non-invasive, and you know, it's low risk, and it's very gentle, and you know, a lot of people are afraid of it because they haven't experienced it.
Right.
And a lot of the patients tell me, you know, I was so afraid for nothing. This is great. I tell all my friends to come in here because it's so gentle. You know, we've had great results with patients who have been diagnosed with fibromyalgia, which is just, you know, a lot of pain all over your body with lots of trigger points. And we've been really successful in giving some gentle care and some good direction for these people who suffer from this terrible pain-generating diagnosis, and you know, can affect the whole body. So you know, we talked about the sciatic nerve being the largest nerve in the body.
Right.
Yeah, and it's formed out of the lower segments of the lower back, and then the one big nerve gets together in your butt, and then it goes down the leg and can affect you all the way down into your feet. And so any kind of sciatic or leg pain, you know, requires a thorough examination to make sure that that's what you have and see where it's coming from and what we need to do to take care of. And of course, disc bulge, herniations, or ruptures. We have several different ways we can treat that. Just because you have a herniated disc does not mean that you need surgery. I want to say that loud and clear because, you know, it's good to try conservative things before a surgery.
Yeah, because you've showed us before the thing that you use to kind of expand the bulge or to give some relief to that.
Yeah.
Which is quite an amazing little piece of equipment there.
Yes. So you see this bulging disc here in between the two bones, and that's putting pressure on the nerve. So with our decompression table, we can actually target that area, open this up so the disc material can begin to heal, taking the pressure off the nerve. And we get great results with this, either on our decompression table or with our decompression tool.
Wow.
Both give phenomenal results for this disc bulge, herniations, or ruptures. And it's great to try, like I said, conservative treatment before you do something really invasive, you know, that's going to cause a permanent change in your spine.
Yeah.
So I'd love to talk about plantar fasciitis.
Okay. All right. We've got a minute left.
Got 1 minute left. So if your feet's not happy, nothing's happy, right?
Amen to that, sister.
So the pain with that first few steps in the morning and hurting to walk, you know, that's an indicator of plantar fasciitis. Sometimes people's tendons in their feet get so tight, their little toes just draw up like this, and then it's hard for them to walk.
Ooh.
And I tell you, I love to work on feet. It's one of my favorite things to treat and help those feet feel good again, so you can get back on your feet, enjoying life. I tell you, so many people's lives change coming in here and getting their feet treated, and in a non-invasive way, without shots, without, you know, surgeries. It's a good deal.
It really is. Well, as you can see, as mentioned, the different conditions that they do treat here at Spencer Chiropractic. If you're having any of those problems, what you need to do is give her a call, and the number's on your screen. Set up an appointment. They're located on Pass Road at Gulfport, right across from Pass Road Elementary. And you know, if you're suffering from any of these things, before you decide to have some surgery done, let them take care of you here, the professionals at Spencer Chiropractic on Pass Road in Gulfport.